Hi, myself Riddhi Joshi, and I'm going to talk about the ECG interpretation for physiotherapist. First of all, we need to know about the ECG strip. If we know about the ECG strip, then only we can say anything to anyone that okay, you are having this problem. If we don't know about it, we cannot explain to anyone else. So the first we need to know about the ECG strip. This is ECG strip. If we take the one piece of the ECG strip, let's see, it records at 25 millimeter per second. So this whole strip, it records at 25 millimeters per second. If we take this small square out, so it is 0.04 second. If we take this large square out, it is 1, 2, 3, 4 and 5 small square. So if one large box is there, it is 0.20 second. Again, if we take 5, 1, 2, 3, 4 and 5 large square together, and if we multiply it, it will be 0.20 into 5. So it's 1 second. Now we need to know about the timing. So this horizontal line, it measures the time, so it will be in seconds, and the vertical line, it measures the voltage. We need to know about the ECG waves. Earlier we saw the ECG strip. Now we are going to see about the ECG waves. Whenever this is atria and this is ventricle, so whenever both atria get depolarization, it is always denoted by P wave. So here in the first diagram, the atria begins to depolarization. So we can see the atria start to depolarization. In the second diagram, we can see that the atrial depolarization is completed. And then we go to the third slide. Third picture, the ventricular starts to depolarization and atria get repolarization. So ventricular depolarization, it always denoted by QRS complex. The ventricular depolarization, it begins at the apex, it goes upward superiorly as the atria repolarize, and the ventricular depolarization is completed and it is denoted by the QRS complex. Whenever ventricular repolarization starts, as we can see with the green marks, it begins with the ST segment and the T wave. So when ventricular repolarization is completed, it is denoted by the completion of the T waves. So in the graphical representation of the P wave, it is denoted by the depolarization of the both atria, as we have seen in our earlier slides. So P wave is always helpful for some diagnosis of myocardial infarction patient or any other drug indication and contraindicated patients. When atria and the ventricle get the depolarization or the repolarization, or else when impulses is traveling, we can see here, if the impulses is traveling from atria to ventricle, it is always denoted by PR interval. So PR interval, the duration is 0.12 second to 0.20 second. PR interval is always helpful when the patient is having some heart abnormality. When the ventricular depolarization is started, it is denoted by the QRS complex. The QRS duration is 0.8 to 0.10 second. Here we can see that the R wave, it is the positive deflection. The Q wave is negative deflection and the S wave is followed by the R wave. The ventricular depolarization is indicated by the QRS complex. After the ventricular depolarization, there will be ventricular repolarization. It is denoted by the ST segment or the T wave. This is P, Q, R, S and T. So this QRS complex and this is T wave. So in between this is called the junctional point. This junctional point is always helpful to diagnose the exercise ECG testing. So we need to always remember where is the junctional point. After the ST changes, it is sometimes ST changes will be it's helpful for diagnosis of the myocardial infarction patient. So it is very helpful for the diagnostic purpose. When the ventricular repolarization is started, it is denoted by the T wave. So T wave is very important to show the ventricular repolarization, and sometime if we have some oxygen depletion and oxygen problem and it will be ischemia, so at that time the T wave get inverted, so it will come here. So it is also important to know about the T wave. Whenever the ventricular depolarization started and the repolarization occur, let's go to the previous slide. When the ventricular depolarization is started and the ventricular repolarization is started, it is always denoted by the QT interval. If there is any abnormality in the P wave, this QT interval gets shortened, and it will be always helpful for the diagnosis of some drug toxicity or some hypokalemia, hyperkalemia. So the QT interval is 0.4 to 0.43 second. We need to always know about the one R wave to another R wave. This is called R interval. It is 0.6 to 1 second. If we take one QRS complex to another QRS complex, it is called the RR interval. What are the steps in the ECG? So there are several steps in the ECG. Whenever we are taking the ECG of the patient, we need to know about the heart rate of the patient. It is normal or abnormal. We need to know about the rhythm. As we read in the last slide, RR interval, it is helpful to denote the rhythm. If we need to know about the P wave, it's helpful during the investigation of a myocardial infarction patient or any other patient with the cardiac abnormalities. PR interval is always helpful in the cardiac patients. The QRS complex is also helpful for the diagnostic procedures in the cardiac patients. How to calculate the heart rate and what is the importance of the heart rate? When there is a normal heart rate, it ranges from 60 to 100 beats per minute. We need to know about the atrial rate, so we should count the number of the P waves 1, 2, 3, 4, 5 as like this. If the patient is having sinus tachycardia, so the beat will be greater than 100 beats per minute. As we can see, this is 300, so it is more than that. So it may occur due to some problem or due to some exercise during myocardial infarction. When the patient is having sinus tachycardia, it is also known as the chronic non-paroxysmal sinus tachycardia. It is elevated the resting heart rate or exaggerated response during exercise. So for this patient is having some kind of the disease or any other kind of the problem. So for that doctor will prescribe the beta blockers. For that patient who is having sinus tachycardia, their heart rate rhythm is regular. The P wave is always follow the QRS complex, but if the heart rate rhythm is exaggerated, so sometimes we cannot differentiate between the P wave and the T wave. So during sinus tachycardia, we need to know about the P wave and the regular rhythm. PR interval is normal 0.12 to 20 second and the QRS is less than 0.12 second. Next, we can discuss about the sinus bradycardia. So if the beat is less than 60 beats per minute, the patient will be feeling bradycardia. The sinus bradycardia is commonly found in the healthy individual as well as the well-conditioned athlete. There is one interesting thing also in this. Some scuba divers, if they are diving inside the sea, they need to consume they need to store more oxygen. So for that patient, sinus bradycardia is helpful. If the heart rate is less than 60 beats per minute, we can see this RR interval, it get prolonged. But the regular rhythm will be the regular. P wave always follow the QRS complex. Before each QRS, the P wave is identical. PR interval is normal. QRS duration is also normal. Let's see how to calculate the heart rate. There are several ways to calculate the heart rate. First is rule of 300. So if we have ruler, we should put it here and calculate from R to next R interval. This is 300, 150, 100, 75, 60 and so on. Like this way, if the rhythm is regular, we can use the rule of 300. Remember, only if the rhythm is regular, we can use 300. We cannot use for irregular rhythm. It won't show the accuracy. So first we need to count the number of the large square between two R waves and divide with the number into the 300. The second method is 3-second method. In the 3-second method, we need to count the number of the QRS complexes in period of a 3 seconds and multiply it by 20. So we need to calculate the QRS complex. This is the 6 second. This is whole 6 second mark, and among of that they have cut into the 3 second mark. So in 3 second mark, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 and 15 large boxes will be there. So this, if the 15 large boxes is 3 seconds, then 30 large boxes will be 6 second mark. So if we want to count the 3 second mark, we need to know about the QRS complexes in 3 second mark. It is 1 QRS complex, 2nd QRS complex and 3rd QRS complex, and we are going to multiply it with 0.20, so it's 60. Now 6-second method. As we have seen in our earlier slide, if the 15 large boxes it's 3 seconds, then the 30 large boxes will be 6 seconds. Let's count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29 and 30. So it is 6 second ECG strips. So count the number of R wave in the 6 second period. It is always used for the irregular rhythm. As we have seen in our previous slides, that if we are having regular rhythm, we can count by the 300 method. But if we have irregular, so what we can do? We can calculate with the 6 second method. Let's calculate the R wave in the 6 second method. This is 1 R wave, 2 R wave, 3 R wave, 4 R wave, 5 R wave and the 6th R wave. So 6th R wave into 10 is equal to 60 beats per minute. There is block method also there, so it is helpful to calculate the heart rate. There are small block method and the large block method. So first of all, we need to know about the small block method. So first we will take the QRS complex that exactly on the vertical line, and thus for small block one big block means RR interval is equal to 5 little blocks, and we need to divide it with the 1500. Here if we see the 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21 and 21.5. So we need to divide it with 1500 and the number of small square in the one R wave to next R wave. So it is 21.5. So it's 69.5. So our heart rate is 69.5. Let's see the large block method. In the large block method, we need to remember the ruler method. So it is 300, 150, 100, 75, 60, 50, 43, 37. So each one box there is one dark line. So we need to calculate it. If it is started from one R wave, so we need to this is one R wave, so we need to calculate it from here. 300, 150, 300, 150, 100, 75, 60, 50, 43 and the 37. So 300 divided by the large square in the RR interval. So this is called large block method. Let's see about the rhythm. What is the normal rhythm? So we need to know about the definition of rhythm. It is a sequential beating of a heart as a result of generation of electrical impulses. It may be regular rhythm or irregular rhythm. Whenever there is a regular rhythm, the R to R interval will be regular and the heart rate will be 60 to 100 beats per minute. P wave always follow the QRS complex. PR interval will be normal. QRS duration will be normal. Let's see the irregular rhythm. The interval between R wave is not regular. First we can see this regular rhythm. The RR interval is same. We can see here the R to R interval is irregular. If the interval between R wave is variably, it is greater than 0.06 second or a 1.5 small boxes, then the rhythm considered to be irregular. So one small box is 0.04 second. If it is greater than that, if it is greater than 0.06 second, then there will be abnormality in the rhythm. Let's see about the P wave changes. The P wave discharge of the SA node and depolarization of both the atria. So what P wave represent? It represent the discharge from sinoatrial node and the depolarization of both the atria. So we can see some normal P wave changes and some abnormal P wave changes. The best to look of the P wave is lead V1. The normal P wave is always upright and rounded. This is rounded and upright. The P wave in general should not be more than one box wide, one large box wide. The P wave contour should be constant. It should not be sawtooth type. If there is an abnormality in the P wave, so what will be the cause? What happens? Let's see. If the P wave exceeds the normal range from the duration or the voltage, like it may be rounded, inverted, peak. So it is generally means either both atria is enlarged or hypertrophied. Remember, if the P wave contour is peak, see here it is peak, and it suggests the right atrial hypertrophy. If there is a broad slurred increase in the duration, if it is increased duration, suggested the left atrial hypertrophy. When the P wave is biphasic, like it may be positive like sawtooth, up and down. So it is due to the right atrium hypertrophy, and the negative deflection due to the left atrial hypertrophy. If the P wave contour changes between the beats, it means that there is ectopic atrial focus, means the impulses is travel from the not from the atria, some else places it is coming. As we are physiotherapist or physical therapist, so we need to know about the physiotherapy implication for the P wave abnormality. Remember, if there is an absence of P wave, then what it indicates? P wave indicates atrial depolarization. So if it is absent, so there is no atrial depolarization. There will be atrial fibrillation or sinoatrial arrest. So impulses is not coming, so there will be sinoatrial arrest or atrial fibrillation. So what are our responsibility as a physiotherapist? We need to first call 911 and the physician simultaneously. Either we need to refer. So let's see. If there is a circulatory problem, like blood circulation problem, there will be atrial fibrillation. So if there is atrial fibrillation, there will be oxygen demand is more and the oxygen consumption is more, and patient is not able to reach the oxygen demand. So for that reason, there will be atrial fibrillation and heart will try to catch the beat. So at that time, we need to stop the exercise, refer them to the physician and call 911 immediately. Because if patient is go for the atrial fibrillation, it may be got life-threatening for them. If the patient is having sinoatrial arrest, it will be most dangerous for them. So SA node cease to generate the impulses. So SA node is the main conductive system of our heart. So at that time, we need to stop the exercise and refer the patient to the physician, because if we are continuing the exercise, patient may get die, and it is our liability that we should always think about the patient first. That's why we need to stop the exercise and the refer to the physician. If the inverted P wave, so what is indicate? See, in earlier slide the P wave is rounded and P wave is upright, but here the inverted P wave, so it indicates ectopic atrial focus. Impulses is not generating from the atria, it is coming from some else places. So it may occur in some young patient, there will be change in the heart rate, and because of this we need to first stop the exercise and we need to check the vitals, because impulses is not generating from the atria, so it is generating from some another place. There will be heart rate abnormality. So first we need to check it is really a heart rate abnormality or not. That's why we are stopping the exercise and we are referring after checking the vitals. If any abnormality is there, then only we are referring patient to the physician and we are calling to the other doctor. Let's see some more abnormality of the P wave. Here in the diagram A, the P wave is widened, and in the diagram B, the P wave is notched and little bit inverted. So there is positive and negative deflection. If there is a negative deflection, we always remember as a left atrial enlargement will be the cause for that. So what is our responsibility as a physiotherapist? If we are doing some exercise and we know about the history of the patient, so we just need to monitor the symptoms of the patient, because we know that the patient is having left atrial enlargement, so there are some changes, they are having some pain, or they will get anxious, or they are feeling breathlessness. If it is acute, you don't know anything about the history, then we need to immediately refer them to their physician. Physician will check everything for them and they will allow us to do exercise again or not. It is on their hand. Remember, if the tall peak P wave, there will be right atrial enlargement. The common cause is COPD. the chronic obstructive pulmonary disease. Right atrial enlargement will be there in the COPD patients. As we already mentioned, if the patient is having the history of right atrial enlargement, we need to monitor the symptoms because we know that they are having the right atrial enlargement. If it is acute, then we need to immediately call to the physician and they will allow us to do the exercise or not. It's on their hand. Let's see about the PR interval. Normally it measured from the onset of the P wave to onset of the QRS complex. This is onset of P wave and the QRS complex. So the normal duration is 0.12 to 0.20 millisecond. If we count the small box 1, 2, 3, 4, it's the small box. So the small block will be count as how much millisecond? We always count as 0.4 millisecond. So it's 4, 4, 8, 12, 16 and the 20. So it's 0.12 to 20 millisecond. If it is normal, then it's fine. But it is abnormal. If it is less than 0.12 duration, it's called shortened. If it is greater than, there will be prolonged PR interval, greater than 0.20 millisecond. The abnormal PR interval 0.12, it will occur in the Wolff-Parkinsonism-White syndrome. It means the electrical conduction is coming from the atria and the ventricle. In between the pathway, the electrical impulses is coming. So the duration will be shortened. It will be less than 0.12 millisecond. If it is greater than 0.12 millisecond, there will be always prolonged PR interval, and the PR interval is greater than 0.2 second, then the AV block is present. 0.20 second, then AV block is present. The several blocks, it's like first degree AV block, second degree or third degree AV block. Let's see the first degree AV block. If there is a first degree AV block, then the PR interval is greater than 0.20 second. As we have already mentioned, the one large square will be how much? 0.20 millisecond. So here we can see this is P QRS complex. So here the PR interval is greater than that. So there will be prolonged PR interval. That means there will be conduction delay. The conduction system, it is from SA node to AV node, sinoatrial node to the atrioventricular node. So conduction delay is there. That's why the prolonged interval of the PR interval. If there is no block at the atrioventricular node, the P wave is always get married to the QRS. There is no missed beat. We can see in this whole ECG street. Here the the P wave is always follow the QRS complex. Second degree atrioventricular block. It has type 1 and type 2. So first type is Mobius type 1 or Wencken-Beck. So in the second degree AV block, the characteristic is decreasing the RR interval until the pause. See, here we can see this is one R wave, second R wave, third R wave, and there is one pause over here. Again there is R wave, pause, 3 R wave, pause. The pause is less than preceding in the RR interval, and the RR interval after the pause is greater than the RR interval prior to the pause. In general, if we are taking this ECG strip, we can see this RR interval 1, 2 and 3, 1 RR interval, 2 RR interval. Then there is one gap. So here the interval is less than the other RR interval. But after this pause, we can see that this is a pause. This is 1, 2 and 3 again 1, 2 and 3 and pause. So it is greater than before. If the increase in the PR interval until a QRS complex is dropped, and this is type 1, so it's benign. There is only changing in the RR interval and the PR interval. So here the PR interval, this is P, Q and R. So we can see this, the PR interval is increasing until the QRS complex is dropped here. The second type 2 atrioventricular block is called the Mobis type 2. In this the PR interval is fixed. Earlier it was varying. Here we can see this is the PR, this is P wave, Q and R. So the PR interval is not varied. It is constant. There will be always more than one P wave than the QRS. We can see this is a P wave again. If we see here, there is 2 P waves, more than one P wave. The P wave is always come before the QRS complex. That means P wave is married to QRS. This P wave is married to QRS. The PR interval is prolonged here, but it is fixed prolonged, not varying. The QRS is always identical. The main characteristic of the type 2 is dropped in the QRS complex. It will be in repeating pattern, if we can see. This is PQRS, 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 drop QRS, drop QRS. The level of conduction problem is usually lower than the AV node. It is often involved the bundle of His. The last one is third degree AV block. So in that the P wave does not follow the QRS. There will be more than one P wave. This is P wave, no QRS, again P wave, QRS. So P wave doesn't follow QRS. Narrow QRS, low rate between 40 to 60. Here we can count that this is 300, 250, 100, 75, 60, 50, 43. So the rate is between 40 to 60 and there will be complete block. Here the P wave abnormality is identical and the PR interval is prolonged. The widened QRS rhythm, this QRS rhythm, it is widened. So this is suggest a ventricular escape focus or idioventricular rhythm. So in order to calculate or in order to see the characteristic of the third degree block, we always see the relationship between P and QRS. So P wave doesn't follow the QRS and more than one P wave. As we are physiotherapists, so what are the physiotherapist implication for the PR interval abnormality? If it is increased PR interval, it lead to the conduction abnormality and the atrioventricular block. So whenever there is a block, patient may have the severe chest pain or the second anginal attacks. So oxygen deprivation will oxygen supply will be less and patient will for more dizzy. So for that reason we need to stop the exercise and we need to immediately refer them to the physician. As a PT, it is our responsibility that we should refer them to the physician so he can take care of them. If there is a decreased PR interval, same way it will be the abnormal conduction pathway. So from SA node to AV node, any conduction delay will be there. So because of this, we need to stop the exercise and refer them to the physician. Because whenever there is a conduction problem, patient will always feel some kind of the chest pain or breathlessness. Let's see about the QRS complex. The ventricular depolarization is denoted by QRS complex. The normal duration is 0.8 to 0.12 second. That means 1, 2 and 3 horizontal boxes. So the small boxes duration will be what? As we have seen in our earlier slide, we can see that the small boxes duration will be 0.04. So let's calculate it. 0.4, 8 and 4 plus 4, 8 and 4 is 12. So it is 0.8 to 0.12 second. If it is greater than 0.12 second, so it will be prolonged. The prolonged QRS greater than 3 square, it indicates bundle branch block, right or left bundle branch block. Maybe some drug induced toxicity or hypokalemia or Wolff-Parkinsonism White syndrome due to shortened QRS complex. When there is an abnormal QRS complex, there will be delay in the conduction from the ventricles and it lead to the prolonged QRS complex. Let's see the physiotherapeutic implication for the QRS duration. It is due to the right and left bundle branch block, drug toxicity or hypokalemia. So there will be less oxygen and increased demand. So we have to stop exercise and refer them to the physician, because physiotherapist cannot prescribe the oxygen to the patient, and this is the duty of the physician. So we have to refer them and stop the exercise, because if they feel more dizzy or more breathless, so it will be complication for the patient. Q wave abnormality. Whenever there is a Q wave abnormality, it indicates the presence of infarction, myocardial infarction. It is normal only in the lead 3 and the AVR. When there is an abnormal Q wave, there will be infarction. This is the pathological Q wave. This is P wave. This is Q wave. This is P, Q, R, S, T. Let's say something about the T wave. So normal T wave, it will be the upward deflection after the QRS complex. It represents the ventricular repolarization. In general, the T wave are in the same direction as a larger deflection of the QRS. It's only negative in the AVR. If there is an abnormal T wave, primarily the T wave changes, it is due to the repolarization problem. Secondary T wave changes due to the hypertrophy. Let's see about some T wave changes which is abnormal. If it is tall and peak T wave, it is due to the hyperkalemia. So as we are physiotherapists, what are the physiotherapist implications for the hyperkalemia? Due to hyperkalemia, there will be increased extracellular potassium and decreased myocardial contractility. So there will be a prolonged increase in the potassium. It can suppress the impulses generation, and it may lead to the conduction block or cardiac arrest. This is a very serious condition. So because of conduction block abnormality and the cardiac arrest cause, we need to stop the exercise and refer the physician, because if the patient is faint or die, it will be our liability. If there is a ST segment or T wave changes, as for example depressed ST segment, flattened T wave, there will be hypokalemia. The myocardium is hyperexcited because heart wants to beat and the ventricle doesn't repolarization. So increase oxygen demand but not fulfilled. So because of this, patient is feeling breathlessness and trying to catch the beat. So this is very life-threatening. It may lead to the ventricular tachycardia or ventricular fibrillation. So we need to stop exercise, call 911 and the physician as well. If there is a inverted T wave, so if inverted T wave, it always denotes the ischemia. Ischemia is immediately stopping. As a physiotherapist, we need to always stop the exercise because patient is not able to breathe. and it may be life threatening for them if we don't stop the exercise. It may lead to the cardiac arrest for the patient, and that's why we need to stop exercise, call to the physician. If we want to see about the hypokalemia, hyperkalemia changes in the detail, just have a look on the series of these ECG videos. Let's see about the U wave. Normal, it is upright and always follow the T wave. This is P, Q, R, S, T and U wave. If it is abnormal, presence of U wave indicate hypokalemia. Inverted U wave, the physiotherapist should know that inverted U wave always denotes the myocardial ischemia. So if it is ischemia, our responsibility is to stop the exercise. Whatever we are doing with the patient, tell them to stop the exercise and refer them to the physician or their doctor. Guys, if you have any doubts related to any topics in NPTE or PCE, please let me know in my comment section so I can make videos on that.